Welcome to This Explainer. So, have you ever actually stopped to think about the invisible infrastructure that powers our entire global medical system? I mean, when you get a blood test in one clinic, how exactly does a specialist in a totally different hospital system know what those results mean? Today, we're zooming in on the absolute unsung hero of healthcare interoperability. It's called LOINC. We're going to break down exactly what this system is, how it functions as a literal universal translator for global health data, and honestly, why it's absolutely crucial for the future of medicine. Let's dive in. But to really grasp the solution, we first have to understand the problem. So, how do global health systems actually communicate with each other? Well, historically speaking, the answer was not very well. Just imagine the pure chaos of fragmented medical records. You've got one lab calling a test heart rate, while another just types in HR. And the computer system, it has zero idea they're talking about the exact same thing. This right here is the interoperability crisis. When our systems can't speak the same language, data just gets lost, diagnoses get delayed, and ultimately, patient care suffers. We desperately need our medical tech to communicate seamlessly, no matter where in the world that data is coming from. Section 1. What is LOINC? So, LOINC is the international standard for identifying health measurements, observations, and documents. Seriously, think of it as the ultimate universal translator. It's kind of like a barcode in a grocery store, right? That barcode tells the checkout scanner exactly what item you're buying, regardless of the brand on the box. Well, a LOINC code does the exact same thing for a computer system. It tells it exactly what health measurement is being discussed. Whether we're talking about a vital sign, a lab result, or a clinical document, LOINC slaps a unique, standardized identifier on it so that every single system, everywhere, knows exactly what it's looking at. And just think about the massive scale of LOINC's reach. You've got so many diverse groups relying on this one standard. We're talking reference labs running tests, healthcare providers interpreting them, and government agencies tracking public health. Then you throw in insurance companies processing claims, software and device manufacturers building the actual tech, researchers crunching massive data sets, and yes, even consumers like us trying to make sense of our own health portals. The big takeaway here is that LOINC is the digital bridge that's seamlessly moving data between all these distinct, often totally siloed groups all over the globe. Section 2. Global Health in Action. Now, in the regular tech world, we're all pretty used to software updates. But in the medical world, a data standard update is a massive deal. LOINC version 2.82 is now live, and it proves that these data standards aren't just, dusty old rule books sitting on a shelf. They're actively and rapidly evolving. Every single new version brings refinements, fresh codes, and way better ways to track the constantly changing landscape of human health. And why do these rapid updates actually matter? Well, because global emergencies do not wait around for administrative paperwork. The system is built to quickly push out special use codes for outbreaks like hantavirus or, say, a completely new Ebola virus strain. It's literally pitting IT administration directly against frontline healthcare threats. When a new viral strain pops up, labs and hospitals worldwide need an immediate, standardized way to report and track it. By issuing these special use codes, LOINC makes sure public health officials can monitor outbreaks in real time. It just proves this data standard is absolutely a critical weapon in our global crisis response. Section 3. Navigating the ecosystem. Okay, a really crucial point here is accessibility. Now, you might be thinking a system this powerful and globally integrated would be locked behind some massive paywall or require a super complex enterprise license, right? Nope. Accessing their core powerful web applications is as simple as signing up for a free LOINC login. They've intentionally kept the barrier to entry incredibly low. Why? Because they want to encourage widespread global adoption of the standard. So once you're logged in, how on earth do you find what you're looking for among thousands and thousands of codes? Well, you basically have two main tools. First up is Search LOINC. It's a powerful web app that's highly search-based, which is absolutely perfect for when you already know the specific health concept you need. On the flip side, you have the Hierarchy browser. This lets you peruse LOINC codes by navigating through structured hierarchies. It's kind of like the difference between typing a specific phrase into a search engine versus wandering through clearly labeled aisles at a library. And the best part? Both are totally free to use once you're logged in. Of course, whenever you're dealing with a massive database, you're going to run into questions. It happens. Whether you're a software developer trying to integrate an API or a lab manager trying to map your local codes to the international standard, you're covered. Their knowledge base is specifically designed to be your go-to starting point for quick onboarding, easy troubleshooting, and just finding fast answers when you're stuck. But hey, what happens when medicine advances, which, let's face it, it does every single day, and you need a code that literally doesn't exist yet? Well, it's actually a very dynamic, collaborative pipeline. If you can't find an appropriate concept, you don't just throw your hands up and give up. Instead, you can follow the instructions to request a new code via their LOINC Request a LOINC portal. And from there, it's pretty cool. You can actually check the public submission queue to see all the new concepts they're currently working on, including the one you just submitted. It totally transforms what could be a static database into this active, community-driven organism. Section 4. The future of interoperability. Now, we all know no single standard can do everything, which is exactly why collaboration is so key here. A major strategic initiative right now is the LOINC ontology. Basically, this is a super powerful interoperability solution born from a team-up between LOINC and another massive health terminology standard called SNOMED-CT. By aligning these two giant systems, they're actively closing the gaps in medical data translation. For those of you who really want to geek out on the deep technical architecture of this, you can learn a lot more over on their dedicated collaborative website. And to keep everyone on the same page with these massive projects, they host major gatherings. The 2025 LOINC conference was a really cool hybrid event, happening both in Montreal and online. But the great news for us is that you didn't have to be there to get the insights. You can easily watch the recordings from this most recent event to catch up on all the latest strategic plan summaries, annual reports, and future roadmaps directly from the actual experts who are shaping the standard. But beyond the big official conferences, there's a daily conversation happening. Because behind all this rigid code and data is a surprisingly vibrant human network. The community forum is this awesome place where you can ask questions, participate in deep technical discussions, and just chime in on conversations with your fellow LOINCers. It really is this active, passionate community that ensures the standard stays practical, useful, and responsive to the actual real-world challenges healthcare providers face every day. Right before we wrap up today, it's definitely important to acknowledge the foundational stewardship behind all of this work. The copyright belongs to the Regenstrief Institute, and you'll see it spans from 1994 all the way through to 2026 and beyond. That highlights over 3 decades of dedicated, continuous effort by the Regenstrief Institute to build, maintain, and offer this incredible resource to the world. It really is a monumental achievement in medical informatics. Which brings us to our final thought for this explainer. As global health threats evolve, is our data ready to speak the exact same language? We've seen firsthand how a new virus strain requires immediate, standardized communication to mount any kind of global defense. LOINC provides the dictionary, the tools, and the community to actually make that happen. But here's the catch. It requires continuous adoption and vigilance from healthcare systems worldwide to ensure that when the next big crisis hits, our invisible infrastructure is strong enough to handle it. Thank you so much for joining me to unpack this fascinating topic. Stay curious and keep learning.